Dr. Jeffrey Carlson, Orthopedic and Spine Center in Newport News, one of the spine surgeons here. We've had some questions concerning neck surgery and disc surgery in the neck, and how innovations in neck and back surgery are improving patient outcomes. One of the things that we're doing here at the Orthopedic and Spine Center is talking to patients about what they expect out of their surgical interventions, what they expect out of their procedures themselves, out of their hospital stays. And most patients are saying they don't want to stay in the hospital, they want to go home the same day. So over the past couple of years we've been developing techniques to be able to get patients home the same day. In the neck, we have several bones in the neck, as well as the disc between each of the bones. The discs are what allow the bones to move. And as those discs move, they tend to wear out and they can rupture. They can pinch the nerve roots. If these are the discs that are here, the nerve roots come out of these little holes on either side. We call it a neuroforamen. So when that disc ruptures, it pinches the nerve root, causes the pain going down into the arm. You get numbness, tingling, weakness into the arm. The standard procedures that we use to treat that include physical therapy, medications, injections of cortisone, we call epidural steroid injections, to help decrease inflammation and pain around the disc and around the nerve. When patients fail those sorts of things or don't get better with that type of care, then the next step would be a surgery. And most of the time that means going in through the front of the neck, making a small incision, taking the disc out, and then replacing that disc either with a bone graft and a plate or a disc replacement. Disc replacement we've been doing for a while, trying to get patients better and maintaining their motion in the disc space itself. The most common procedure, however, is a plate and fusion technique. So going in through the front of the neck, removing that disc material that's there, and then putting a piece of bone graft and a plate on the front. With newer technology and newer techniques, smaller incisions, less blood loss, and less work that needs to be done on the front of the neck, we're able to make a smaller incision and putting in a smaller plate and screw technique. And these patients now have a surgery that takes about an hour to do and can go home the same day. The same results happen. So the arm pain goes away, the pinching of the nerve is removed, so that the patients feel a lot better for their symptoms related to their disc itself. The surgery itself is not as painful anymore. You have a smaller incision, you have less work that needs to be done to remove the disc material itself, and less trauma that's done to the patient by changing the technique. The smaller plate and screw alignments there allow for less exposure, so that you're able to put in a smaller plate with the same stability that we have with a larger plate, but be able to fix the patient's neurologic problem as well as combine that fusion technique and stabilization of the bones.